So, good morning, afternoon, or evening, depending on where you are on the globe. This is our first GBV AoR call for this year. So we're very excited about having you all on our call. I'm Jennifer Chase, in case you haven't met me. I'm the GBV AoR Global Level Coordinator based in Geneva. And we've really looked to have a mix on this call of both coordinators and IMOs, information managers, speaking from the field and sharing the work that is going on right now, in addition to having presentations from global level actors. And we will try to be doing this mix in the future. We are always aiming for also an audience of our coordinators and field actors, as well as our core members and people who are interested in GBV. And if you have feedback for the call itself, or if you would like to make a suggestion of something that we cover on the call, a topic or an issue, or if your organization wants to present something, you can write to Shiva. She'll put her email in the chat. We are open to feedback from our listeners. And then just to say, if you have a question, we're going to have time for questions and answers between each presentation. And if you want to write down the question while the presentation is still going on, so that you don't forget your question, or if you're shy, or if your microphone doesn't work, then you're welcome to write the question into the chat. You're also welcome to introduce yourself on the chat if you want others to know that you're on this call. That is also welcome. So thank you all for joining. And I know many of you have been anxious to have an update on Tigray. So we are going to start with Tigray, and with our coordinator there, Jianze, will be presenting first.
Hi everyone, it's Dientje here from the GBV AoR Ethiopia. Hope you can hear me well, and do let me know if any issues. So I'll provide a brief update from the Ethiopia side on the current Tigray crisis, or as we sometimes call it, the Northern Ethiopia crisis, because it's of course also spilling over and having its effects on some of the bordering regions around Tigray. Especially the district levels in some of the that are immediately close to Tigray region. So I'll be trying to present on behalf of course, the wider GBV AoR in Ethiopia, and I'll also reference throughout my child protection AoR colleagues who are also providing services and are planning to respond to the needs of child and adolescent survivors. Very briefly, some pre-crisis information, as I do think that's important to set the scene and to also understand and anticipate further impacts and needs throughout this crisis. So we've seen that before the crisis, 1/3 of women across Tigray and Amhara regions have experienced different forms of gender-based violence. Child protection is also a huge concern across Tigray, Amhara region and Afar region. So these are the three regions that are affected by the crisis. And those three regions are actually in the top 3 of having the lowest median age of marriage, even though child marriage is outlawed throughout Ethiopia. And we do also see big regional variances. So particularly in Afar region, the rate of female genital mutilation is extremely high, while actually in their neighboring region, Tigray, it is the lowest of the country. Help-seeking behavior, though, is low across Ethiopia and also across these three regions, with only 24% of women having sought assistance from family, the community, or the police after a GBV incident. In terms of a more particular crisis update, So at the moment, we are seeing continued fighting and clashes throughout the region, especially some of as the front line is still shifting. Also, these particular insecure environments are in insecure zones and districts are shifting too. So this, of course, has a lot of impact on the accessibility of Tigray region. Some zones, even right now, 3 months almost into the crisis, some zones have remained completely unreached. Accessibility in and around Mekelle, the capital of the region, is relatively stable. And along the major road from the very bottom of the region to the east, the access, so that is from Syria to Alamata, that road is also more stable. But then if you go inside the rural and more remote areas, these are highly insecure. And again, some of these areas have not been reached at all. Electricity is still a huge issue across Tigray, and even the capital city has been without electricity again for 8 days now. Latest IDP numbers, as they are shared with us on an ongoing basis, but also, of course, very challenging still to collect this information, has been close to 500,000. And at the same time, we are also having IDP movements and settlements in the neighboring regions, so in Amara region and in Afar region. And different IDP camps are quite accessible in those regions because there's no active ongoing security issues there. In terms of GBV, I'm sure most of us are aware and have seen the different horrifying reports from people fleeing violence and fleeing conflict. Sorry, there's a typo on the slide here. It's not reports of sexual violence by people fleeing, but when people are fleeing, whether they are staying behind or hiding or trying to stay in place, where they've left the comfort or sanctuary of their own home to try and access water and other basic needs. There really does not seem to be a safe place for women or girls in particular. And I'd highlight as well that a large number of the GBV survivors include child and adolescent survivors as well. So overall, we're dealing with a high-risk environment with the presence of armed and different military actors. IDP hosting sites are carrying big GBV risks. Some of the all of the assessments have found that women and girls have voiced their safety concerns and fears around the shelters that they are living in, with shelters being inadequate, with broken and open windows, no privacy, overcrowding, as well as that accessing latrines, but also the latrines themselves are unsafe, broken locks, not gender segregated, and some of the IDP sites having no latrines at all, so people having to venture outside and far into and practicing open defecation. There's been several assaults and violence reported for women and girls who are trying to access sanitation facilities. There's extreme food shortages, and food has been a major focus of the response. And linked to this also the observation and assessment findings around different negative coping mechanisms related to this extreme shortages of food and basic needs, including transactional sex and survival sex. The current service environment in Tigray is that there is a one-stop center still operating in Mekelle, so in the capital. And this one-stop center provides clinical management of rape, some basic case management, psychosocial services and counseling, and used to be able to facilitate referrals to legal aid, but this is no longer in place. Sorry, I should have adjusted that on the slide because I'm trying to only capture what is still in place. As well as that they are still able to refer people to the safe shelter, which is operational in Mekelle, as well as that other NGOs are also trying to expand safe shelter services. In terms of health, hospital and local health facilities across Tigray are dysfunctional or have limited functionality. Only 22% were found functional, and so a lot of our the health partners are working through static and mobile health teams including to provide clinical management of rape services. And this also is part of the mobile health team outreach. But they have also found that, GBV survivors preferring to come forward to a static health facility or a hospital, as that gives a more confidential environment. On MHPSS, so there is limited availability. There's definitely areas and possibilities for scale up, but currently it's limitedly available, mainly around Mekelle. We've recently started working together with the university there and the university professors as volunteers, providing more psychosocial support. But this is very limited. Yeah, the reach into other of the town and urban centers has not yet been set up and wasn't in place previously. And especially availability of mental health specialists was already low before the crisis as well, and continues difficult to find and source these specialists. Case management is usually provided through the government, and while some of that is possible in the safer areas, for example in Mekelle, especially outside of Mekelle, where the government structure, especially down to district level, is completely gone or have been completely replaced or non-existent, this is a huge gap. In terms of protection, there is, especially again outside Mekelle, there's no current structures in place, and within Mekelle, the capacity is low or weak. The force has been, substantially reduced, and their capacity in terms of actually protecting and controlling is also very low. There is some ongoing collection of testimonies and statements, both by UNFPA, by other NGO partners, and some of that in collaboration with the Bureau of Justice. And it's yet to be, we need to more comprehensively address also as a sector than what is next about the access to justice piece of this. No legal aid is currently available, and as I had mentioned before, that the safe shelter in Tigray is still available. And I just highlight that a lot of these, and I should have mentioned that earlier, this is now quite focused on Tigray, where the situation is particularly dire. Across, for example, Amara region, where the situation is stable, a lot more of these services are in place. But still there remains a need for either resupplying or reestablishing some referral pathways, but the situation is less dire than in Tigray. So throughout my update, I'll be referring a little bit through the different regions, but the bulk of it will be referring to Tigray specifically. So in terms of the GBV response, in terms of the coordination, there are activated GBV AoRs, and in Ethiopia we operate jointly or hand in hand with our CP AoR colleagues. So this is why you see a reference as well to the CP GBV AoRs, and these have been reactivated in Amara and Tigray, and in Afar we're working through the pre-existing government coordination platform. There's definitely still coordination gaps, particularly for Tigray, which sees quite a fragmented, where communication even throughout the region is still really difficult. So to feed some of that back, and especially in the further removed areas from Tigray, where some interventions are starting, but they perhaps don't have people based in Mekelle. So we're also looking at setting up more localized structures for that. In terms of the pre-crisis capacity, there was no coverage of GBV humanitarian partners before this crisis in Tigray. There were some, and I think we were, I want to say, lucky, or it was very good that, well, there were refugee camps, and are still, or in different stages, refugee camps across Tigray, and there were GBV partners responding in the refugee camps, some who do have in other parts of Ethiopia also experience in the GBV IDP response. So we've been also seeing a shift, and that has really allowed some of our partners to move in and start responding early. There were a considerable number of GBV partners pre-crisis focused on development interventions, focused on strengthening systems, focused on community outreach and prevention approaches, particularly also around child marriage and harmful traditional practices. While in the other two regions bordering Tigray, we had slightly better coverage of GBV IDP response partners, but still it was very low. In Afar, it was really only one, and in Amara, it was on average, I'd say 3 to 4. Then again, some GBV development intervention. So all of this to show that the crisis will require a huge scale up of emergency response capacity, as well as building on these existing capacities that are there, but who may not be completely fit for purpose for the emergency response. In terms of the response plan, we are working also on finalizing this for Tigray region specifically, but overall across Tigray, Afar and Amara, we'll be focusing on the provision of dignity kits in terms of community outreach, awareness raising and promoting risk mitigating actions, especially also integrating some of the PSCA messaging and material. That will be a big focus of our partners, and where possible tagging that on, or very importantly tagging that on to the dignity kit provision as well. Mental health and psychosocial support from the GBV partner side, especially the provision of psychosocial support. And while initially and still a big focus is on psychological first aids, definitely already now partners and we should be starting planning for the more longer term psychosocial activities as well, provided through women's safe spaces or through other mechanisms. Case management will be a strong focus, and while that has previously sat very strongly with the government, we have also seen a shift of that, especially in some of the continued very insecure environments where the government structure has really collapsed. The more direct provision of case management by our partners, and as well over time, this should transition quickly and strongly, but whenever possible, to working more hand in hand, of course, with government and re-establishing some of these structures that were in place before the crisis. The re-establishment of referral pathways and service mapping, and some of this to be done also in a very localized manner, recognizing that while previous referral pathways were very focused on the regional hub, and that should still be a main pathway for zones close to there. With the current insecurity, a lot of these referrals will need to happen through two very local services that are available. Capacity building of service providers, GBV service providers and health service providers on specialized GBV support. But under this also a strong focus on risk mitigation and working with our other sectors to mainstream GBV within their own responses, and that both in terms of risk mitigation, but also responding to GBV survivors when there is no GBV actor present. So the use of the GBV pocket guides, which with a lot of support from UN Women and UNICEF and across the GBV AoR, we've translated this to also now in Tigrinian, and this is in the process of being rolled out and disseminated to partners. Of course, also assessments and coordination. So in terms of our current capacity, we have currently 7 partners on the ground who are responding across 11 woredas. This is across the 3 different regions. And that includes the Red Cross, government departments, IRC, IOM, CARE, UNICEF, UNFPA. There's also 6 additional GBV partners who are preparing to start their service delivery very soon, who've been really ramping up and getting ready, but are also voicing barriers or challenges with staff hiring and finding the right protection staff, for example. Implementation is very focused on currently key accessible areas around Mekele, one of the other hotspot areas around Syria in Tigray, as well as the accessible IDP sites throughout Amara region. I've been mentioning local partners a bit, and there's another, let's say, 10 local partners who are identified with relatively strong GBV capacity, but who would need support and technical guidance to also make them fit for purpose for emergency response. And there's also challenges there with, I guess, the extent to which they are comfortable really going out into some of the insecure environments, and making sure that humanitarian response is done in line with the humanitarian principles, of course, as well. So in terms of some more specific numbers, that we have reached over 100 people. This is again, especially around Mekelle with psychosocial support, women and girls. The GBV Dignity Kits has been a major part of the response, which is over 10,000, and awareness raising is starting to ramp up. And I'd also note that across the child protection response, they have also been responding, especially with psychosocial support to child and adolescent survivors. Yeah, okay. In terms of some key final points on the response plan and our response activities, is that we're really also trying to work across the different sectors. So we're working across with the health cluster, with NFI, and then of course with the border protection cluster and the child protection AoR as well, so that we all have visibility and are streamlining the different parts of the GBV response. And so this is ongoing, this is in development, and it's building on a lot of the actual work that's done on a daily basis. For example, in Mekelle Tigray region, there is very regular communication between the health partners as well as GBV partners. Yes, the estimated cost in terms of the GBV response, but noting that these figures are yet to be confirmed and further validated as we are finalizing the Tigray region specific response plan, is close to 7 million with a current funding gap of 4.5 million. Over 1 million is confirmed funding with partners at the moment, and then over another 1 million approximately is in the pipeline to be confirmed with partners, hopefully very soon. But still there's, I'll touch upon it a little bit in the challenges. So the last will just be the challenges and some opportunities and some key asks. And then I'm finished.
We need to be aware of the time because we have a lot of presenters, so you might need to finish.
Okay, great. Yes. All right. Absolutely. So in terms of the challenges, it's really the insecure environment that's mentioned as a huge barrier and challenge for really ramping up implementation. I was going to say some of the funding flowing down to the local partners who are very ready, who are on the ground. There are barriers there, and as well as our ability to really get people into Tigray in terms of technical capacity. I mentioned already briefly that there is already a good start of funding confirmed, but some of these challenges mentioned before are barriers to actually really showing the numbers that we really should be reaching by this time. And yeah, then finally here as a strong request to everyone and to your Ethiopia-based counterparts as well, to engage strongly with the GBV AoR and to make sure that everyone is linked up, preferably at national and at subnational levels, but most importantly at the subnational levels, to really do the field level coordination, decision making about who's going where, making sure that we're really using the resources that we have in the most efficient way possible. Thanks, that's it from my side.
Thank you for that very comprehensive presentation. I understand you have a briefing note that can be shared as well. Is that true?
Yes, the briefing note is about to be finalized in the next few days, and it will include a lot of the information, especially on the service environment. Yeah.
Great. There's one question in the chat, if we can answer it quickly. And there are a number of people in the chat. I saw IMC, Oxfam, Child Fund, and CARE. So I was hoping we'd have some time for additional comments, but I think we'll move on. And if there's time at the end, then maybe we can have some comments from others on the line. But there was a question about the one-stop shop, who manages it, if it's well equipped in terms of both the facility and the expertise, and also about referral pathways. Are there services to which you can refer people with the referral pathways?
Yeah, so the One Stop Center is a supported center. It's been, I don't know how long it's been functioning, but at least for a year and possibly much longer, supported by UNFPA as well as a local women's organization. They were relatively well equipped in terms of the medical side, and we are currently in the process of also resupplying them. But a big gap had been and continues to be MHPSS, which is now partly covered by some of the university, by a relationship with the university and professors and MHPSS specialists from there providing this support. But definitely more is needed. But at the same time, yeah, there's some pre-established partnerships that are continuing from some of the major funders and technical agencies supporting the One Stop Center. In terms of referrals, especially around accessible areas, we've been promoting the referral to Mekelle across Tigray with any of the medical and health partners that are going out. But again, I'm also recognizing that the key entry point still at this stage of the crisis is very much the health centers and the health partners as initial entry point. And so MHPSS throughout the region, even at the local levels, the service doesn't yet exist. So a lot of the survivors are currently only able to access the health side of the response.
Thank you very much. I know there's a lot of interest, so definitely we will want to share your in-depth briefing note. And just to confirm, can people also be in touch with you directly if they have specific questions for follow-up, that we can channel those questions to you?
Yes, absolutely. I'd also highlight to make sure you're looping in your national counterparts as well, and making sure that we're all talking to each other. But yes, please, I'll drop my email address in the chat.
Great. So I think that's a great suggestion. So if you're working at a global or regional level, please communicate first with your staff member that's working locally. They probably are already working with Genchi in the subcluster. And if not, we would definitely want to see them joining the subcluster and working together to improve coordination, which I know has been a challenge with COVID as well. So definitely, and just to let everyone know, we will share PowerPoints as well as making a recording available of this call. So we're going to move along. If we have time at the very end, then we'll come back to those of you who wanted to make comments who are also working in the Tigray region. So our next topic is on cash and voucher assistance, recent initiatives. And Luana De Souza will be the person who's presenting. Luana, over to you.
Thank you very much, Jennifer. Can you all hear me well?
Very clearly.
Okay, great. So I have just 3 slides presentation. I wanted to quickly update all of you about UNFPA commitment to scaling up cash and voucher assistance. But before that, let me just introduce myself. So my name is Luana. I used to be working with the REGA team in Nairobi as a GBV in emergency specialist. And now I joined a humanitarian office, UNFPA in Geneva. And I support GBV risk mitigation in cash and voucher assistance. So I will explain exactly how my role fits in the overall UNFPA approach. So since, I would say, spring last year, UNFPA has committed to, as I said, scaling up CVA. So this is really what we call a twin track approach, because we are really looking at the operational side and at the coordination side. When we say operational, it's really looking into how we can improve the use of cash for GBV and SRH programming, so for our own UNFPA programming, really making sure that it's a new tool that could be used by GBV and SRH practitioner. So how to make sure that we use it safely, that we use guidelines, protocols, MOUs, etc. So what we have been doing so far with my colleague is really to look at what UNFPA is already doing in terms of cash, so what works, looking at case studies. So some countries have been doing a lot for SRH or GBV or both, but also we have started an exciting partnership with Johns Hopkins University, which will be looking into outcomes and how the cash is used so far by UNFPA. So this is one side, and then we also, of course, support the country. So far, we have supported more than 20 country operations in terms of cash. So this is really the technical and operational support, making sure we build the capacity of our technical colleagues in terms of how to use cash. So this part of the operational side is mostly done by my colleague Joanna Friedman. What I'm here today more to discuss with you about the second part, which is the coordination part. So we really see this twin track approach because we believe that the two really go together in the sense that we need to have the quality of we need to have a good quality in terms of programming. So that our role as the GBV AoR is also enhanced, basically. So it's really an integrated approach. So since October, so this is a bit more recent because I joined in October.
No.
There is someone that has a mic. Okay, so I joined in October, and my focus is really to support GBV coordinators in their engagement with the cash actors in general. So we are looking into what we call multi-purpose cash. So I'm quite sure you all have heard about this massive cash distribution or voucher or e-money. Now we know that it's reaching almost 20% of the humanitarian aid globally. So it's quite a big piece of the pie, let's say. And it's not, cash is not riskier per se, but it has risks. And like every sector or cluster, we need to make sure that centrality of protection is ensured, do no harm, and that we mitigate and prevent as much as we can GBV risks. So what I have been trying so far is really to identify a few countries to do field pilots of what is working and what could be done. So I will discuss in the next slide about that. And to develop a really field-oriented toolkit. So it's a toolkit that has so far 4 or 5 tools, super pragmatic and really developed based on the needs of the field. So in different languages about how you do a focus group discussion with them, how we do a focus group discussion with women, you know, making sure you don't ask questions about, but you keep your question about risks, these kind of things. So if you're interested, please reach out, but we are still in the process of developing this toolkit and rolling it out. And the idea is really that I support these GBV coordinators with the engagement with the cash sector, so usually the cash working group. But we also try as much as possible when it's appropriate and relevant to do linkages with the social protection system and the government stakeholders whenever it's appropriate and it's relevant. We can go on the next slide, and no, the GHU is not public. We just started. It's a 2-year project, so you'll be notified, I'm sure. We'll shout very loud when it's ready. So for today, I wanted to give you something super concrete. So the 2 ongoing pilots that we have so far that are almost over, actually, to be honest, is Somalia and Northwest Syria. So in Somalia, we started last year in May to engage with the cash working group and the GBV subcluster. So they were really keen into getting their cash actors trained on GBV risk mitigation and to make sure that risks were identified and mitigation measures were identified. So it's quite exciting because we have we are part of the protection strategy action plan of the HCT. So we have this accountability at higher level. And so we have, as I said, cash working groups, so WFP, but also the GBV subcluster involved. And so we had many meetings, discussion, group works. I saw Nikiro was on the line. She could tell you it's been a year now. So the engagement was done in Somali and in English throughout, which really gave us the opportunity to have a really local footprint, which was great. And so the key result is a joint cash and GBV work plan for 2021, which highlights basically key risks in cash intervention in Somalia and the mitigation measure that both the cash working group and the GBV subcluster are ready to undertake. So this was, I mean, it was an amazing experience also to see how much cash actors were keen in learning and super enthusiastic about GBV in general. Learning briefs will be ready by the end of March, I hope. So we will share with you I mean, it will be public, so the best practices, the challenges, but also the work plan. So I think this is really something now we are looking into, bringing that to donors, to HCT, to make sure that there is also accountability at highest level. Then for Northwest Syria, I think this is something we haven't been talking so much because it's, as you know, a much more sensitive context. So UNFPA, as I said before, we have this string track approach. So we are doing cash for protection outcomes through our hub in Turkey. And so they have been doing a lot of work with the cash actors already, UNFPA, the GBV subcluster there. And so in short, big actors actually are looking into scaling up cash in Northwest Syria. But before that, they are doing an assessment to make sure that, you know, they are not taking risks. So they are looking at operational risk, financial risk, etc. So what we were able to do is to have around 15 local actors, both cash and GBV, looking into key GBV risks and mitigation measure for the context, so that we would basically bring our own piece to this assessment and looking into the gender aspect. So I think for us as UNFPA, both as UNFPA as an organization, but also as the lead of the GBV AoR, it's a great way of, you know, pushing for GBV to be at the center, to make sure that actors understand that this is not something that is optional, but that they really have to take into account. So it's a great opportunity, and we'll see. So now we are almost done with this GBV risk analysis that we will provide to this UN mission, and then we will see how it goes. So that was what I wanted to tell you very concretely today. And then the last slide, it's more about resources and contacts. So far, you can find the Northwest Syria case study, which is more about UNFPA cash programming in Northwest Syria. It's interesting to know that we are the first one to do cash for protection in Northwest Syria, or among the first ones. We have also a case study from Yemen that where we are also participating into cash for protection. CVA, your role as a coordinator is more or less the key guidance for the work that I'm doing with GBV coordinators. And as I said, we're gonna have additional case studies and learning briefs that will come out from the pilot from Somalia and from Northwest Syria. So I think I took 10 minutes already, time flies. If you have any question, I don't know how much time I have, but thank you very much for your time.
Thank you, Luana. And I think you already responded to the question about the Hopkins study. So unfortunately, we cannot advance time quickly to have a finished product already, but that's exciting that you're working with Hopkins. And just to see if there's anybody else that has a question, if you haven't written it in the chat, I think we could take one question on cash and voucher specifically to Luana. Francois, do you want to say something? You put a message in the chat. Do you want to say something out loud?
Yes, I may. Thank you, Jennifer. Basically, thank you very much also for the presentation, Luana. So
introduce yourself first so people know. Yeah.
Yes. So this is François Saramagnon. I'm working for UNFPA Palestine, and I'm coordinating the GBV subcluster from East Jerusalem. Basically, one of the main concerns from a number of organizations, including ourselves within UNFPA, is how to continue preventing GBV even when cash stops. So when beneficiaries are not receiving cash anymore. So one of the ways we have been addressing this has been through recommending to provide smaller amounts, but for a longer period of time, which is one of the things NGOs and us as UN agencies have been doing based on feedback from beneficiaries. But what would be interesting also for us to know is whether, as coordination groups within a GBV subcluster, we can also step in and support sustained prevention of GBV whenever such programs stop and cash is not flowing anymore. So I was wondering if this was being covered by the Johns Hopkins University study, or if this was something you were looking into as well. Thank you. Over.
Thank you so much, Francois. And absolutely, I completely agree with you. I think it's and it's a complex question that cash actors in general don't really have an answer, no? Because I mean, we know that cash cannot go solo, so it always has to be part of a comprehensive approach and a holistic approach. But we also know that at some point it stops, and then what happens? So to answer to your question, GHU, we will have 6 contexts where they are looking into. So their main questions, research question, is really looking into how can we say that cash contribute to protection? So basically, it's good to have cash, but how does it really relate to protection, feeling of protection? How can we say that, you know, having more cash in the family makes it like less difficult, and then you have less domestic violence, for instance, or how to make sure that, you know, the cash is also used to access services, for instance. So, but what I know is that is a 2 years research, and I think it's interesting also to keep in mind that additional research questions and area of focus will come along. We haven't been, I mean, of course, the 6 contexts, we haven't started the 6 contexts at the same time. So it's definitely something I will bring up to GHU. And thank you very much for the question. I think it's a good it's a good point, and yeah, feel free to reach out should you want to discuss anything else. I think Palestine is a really interesting context as well. Thank you.
Thank you. So I think we'll move on in interest of time, and just to say we have 2 speakers coming up to talk about Sudan. One is Yosto Iba, who is one of the regional, he's the regional information management officer with the Riga team, and he's currently on mission in Sudan. So he's going to talk about his work. And then we're going to have Julia Di Porzia de Brugnera, and I'm sorry if I pronounced that completely wrong, who's been working on the Voices in Sudan project, which is modeled after the Voices report that's been released every year for the last, I think, 5 years in whole of Syria, and they created a manual for countries that want to roll it out. So Sudan is the first country that's rolling it out. So we're super excited to hear about this. I'm going to ask each of you to please try to stick to the 10 minutes that you each have. They're going to be back to back, and then we'll have questions and answers after both of them present. So please do put your questions that you have. Yosto's presenting first while he's talking, and then Julia's questions after that, and then we'll give them a chance to respond after the 2 presentations. So turning over to you, Yosto, and yeah, thank you.
Thank you very much, Jennifer. So first of all, thanks to all of you for having me here. What I'll try to do here is just to give you a snapshot of what my work in Sudan focused on. I really recently finished my mission there. And even before starting, let me just anticipate that all the initiatives that we have started, everything that we have done, it's really the fruit, it's really the result of an amazing collaboration that I had with a team over there that not only made my professional and personal life easy, but they were also the driving force behind pushing and promoting such initiatives. In the interest of time, I'll be very, very quick. So let me divide the work in 3 different areas. The first one is dissemination channel, which I believe is one of the most important yet most overlooked areas of information management. Even before data visualization, even before the 4W, even before data crunching, what I think is a key part of the information management officer role is that of connecting people in between cluster, the cluster coordination team, the partners, make resources available, understand who can find what and where. And that's where we started from, by updating the contact list of partners, by creating, not only creating, but let's say was created by operationalizing a personal email from the GBV subsector, by let's say updating the dissemination list based on audience, and most importantly, by updating the contact list of focal point for the GBV subsector at central level and at state level, where there are sub-working groups active. All of this coupled with, of course, updating another one of the key initiative, which is meeting calendar. Who's meeting what and where do we find this information? All this, let's say, all these small initiatives, small but very basic initiative came together into what I think it's a key, another key part of the information management role, which is creating and updating a common platform for the GBV subsector partners there, for everyone to have information about what is going on. And this is the humanitarian response webpage. And Shiva, you can go to the next slide. Thanks. Now, for just the sake of understanding, these are 2 examples. I know that all of you are familiar, but here you'll see what's being done, or at least what the page in Nigeria looked like in 2019, and a similar example in Mozambique for the Cyclone Idai. If you can go to the next part. Yeah, that's what the page of Sudan looks like. So we have created this from scratch. And if you can see, there's a logo, there are the key contacts, there is a dashboard that somehow anticipate what I'll be talking to you next, which is the 4W and its product. And there's more to that, which you can see, which are the contact details, the meeting schedule, the funding status, and a link to the key documents that are fundamental and that have been published, not only by the subsector there, but also guidances and let's say standards. So these have been promoted and this is now active and updated. And I do believe that in the long run, it will make a difference in communicating information. If you can go to the next slide. The second part is, of course, response tracking and 4W. And this is where the support actually started well before the mission that commenced in January. It started when the HNO and HRP process was in full swing. And it proceeded into 2 parallel tracks. On the one hand, we had collaborating on the definition of reporting indicators. We had collaborating in connecting, attaching such indicators to the activities. And most importantly, in the description and the definition of each one of the 13 activities, together with the guidance on how to report it, together with the planning and let's say the conception of mitigating strategies to reduce double reporting, to reduce double counting, and to increase the accuracy of reporting of partners. In parallel, what we did was try to make use of what was produced last year, to understand what were the gaps of the 4W template, to understand what worked and what didn't on the 4W template, and to crunch and consolidate all such number into something that could be used. Such number that this resulted in a database that was then translated into the infographic that you've seen before, and that I will show you in a minute. If you can go to the next slide, Shiva. Now, of course, these 2 initiatives, which is the one on process indicators and definition, and the other one on data crunching and understanding what worked before in 2020, they resulted in something basic yet I do believe very efficient, which is a new template for 2021. And what is it that we attached to the new template for 2021, which you can see here? We attached a very basic guidance, and we attached a standard training package in order to help them to help partners to report. Training package defined as a PowerPoint presentation with all the elements and with all the let's say the keys that you have to use to report, and a series of short how-to videos that have been prepared and that have been uploaded in a dedicated channel, which is now available for everyone. All of this, of course, together with the guidance note of indicators that's being produced and shared with all the partners. Going next. Now, what we also thought it was important, it was just to realize and to push the button on the fact that this is not just a one-way process. We know that reporting is a big burden. We know that like it's painful to do so at times, but it may become less so if there's something in exchange, if the data that we do collect so thoroughly and with such efforts is crunched into something helpful. And this is the dashboard that we have prepared for 2020 and that we plan to increase and to enrich for 2021. Without going into details of that, let me just say that this has been prepared with Power BI, which I think is a great software because it's an interactive one. So everything can be filtered according to your need. So if you want to know which organization is doing what in which of the localities here, you can just click on it and it'll show everything. Similarly, if you want to know about GBV awareness, that's something that you can use. Just click on GBV awareness and all the data in the dashboard will be filtered accordingly. So that proved to be a very good initiative, that proved to be a very well perceived initiative and something that will definitely form the basis of future data visualization efforts in Sudan. Now, going next. Another one of the key priorities identified by the GBV subsector was a service mapping. Service mapping because before there was no such initiative, at least at national level on service mapping. There were very strong initiatives at state level. There were very strong individuals' effort to collect a certain amount of information. There was one on CMR, or specifically certain states were collecting information on services, but there was no such approach harmonized at country level. So what we have worked on together with the GBV subsector and together with all partners was that on harmonizing the way we collected this information. First of all, by creating a format. And again, it's a simple Excel template modeled around previous initiative, I think from Iraq and beyond, and then discussed and adapted to fit Sudan's needs. In this case, what proved instrumental and very, very important to advance in this process was the retreat that happened in mid-February, and that gathered together all persons, focal point from UNFPA, but also from partners in the same room. And this is where we actually had the chance to let's say, decisively advance in the service mapping by not only agreeing on the template, but most importantly, having process responsibilities and timelines all identified. Now, we all know that like from the conception to the realization, it takes time. But what's important is that we have now a timeline and that by the 10th of April, we should have a first draft of the product. And this first draft will then form the baseline for improving, understanding what did well, what went well, and what didn't, and then adjusting the aim for the future of service mapping and expanding its scope. Last but not least, the main question that buzzed around and that was running through everyone's head was continuity. How can we ensure that the initiative that we're carrying on now do not simply vanish once the mission is over? How can we assure that this can be carried over time? So let's say that here we again proceeded into two different work streams. On the one hand, we have produced an IM minimum deliverable documents that kind of assesses the state of play on a number of initiatives on information management, but also set the target and objective for future's effort on the IM side. On the other hand, we had also produced, which is still being produced to be honest, and cross-checked, a more dedicated work plan with targeted initiatives such as service mapping, 4W, etc., that outlines what are the responsibilities of the GBV subsector and of the RIGA team. This will of course not be limited to the information management, but also beyond to the RIGA colleague in Cairo. And last but not least, which I do believe is the greatest news, and he also may be present here in this call, we hard worked, and thanks really to the team. I'd like to take credit for it, but it's definitely not my not my initiative. Thanks to the team for believing in the importance of information management and for pushing for the PORs and the hiring of a new and dedicated information management for the GBV AoR, which is, I believe, the first in several years, and I believe the one which will give a decisive push in advancing on information management initiative on GBV. There's many more to this presentation, like such as secondary data review, operational presence map, that may be produced soon. But I'll just leave the floor to Julia and to the part which I believe will be the most interesting for everyone, which is Voices of Sudan. Thank you very much for having me.
Thank you so much, Josto, and great presentation. Good afternoon from Kasra, Sudan.
Julia,
this is Julia Di Porcia from UNFPA Sudan, members of the GBV AoR. Can you hear me now?
Yeah, now we can, but you were a little broken at the beginning, so you might want to start.
Oh. Okay. Yes, good afternoon. This is Julia Di Porcia from UNFPA Sudan. Thank you so much for the members of the GBV AoR for having me do this presentation. This is the first time that Voice of Sudan is done, so I'm really grateful for your critical engagement, any feedback, getting in touch bilaterally on this. Let me start with some context, so maybe the first slide. So in Sudan, there is a very scarce availability of data, particularly nationwide, particularly on GBV. There's a census, and on the making a nationwide assessment on GBV was a red line for the government. So this really fills a gap. And it fills a gap also in the sense that the future is uncertain. We don't know whether there will be any space in the future to talk about GBV and to do a study like this. To roll out this research, UNFPA has partnered up with the Ministry of Labor and Social Development. So this is going to be a report co-written by these two organizations, which is great news in the sense that having the government to have ownership of the data is fantastic, and it's fantastic that the government is open to do that now. It also comes with some drawbacks. For example, the fact that there are the definitions that we have used of GBV that are the definitions that are have been adopted by the standard operating procedures to address GBV of Sudan, which are not really aligned with the 2015 YASC definitions. This report really comes from a high demand from donors, from the UN, from coordination structures, from the government of Sudan. So the next slide. In terms of the methodology, it has three components. The first is a desk review of existing assessments, report, and other secondary data since 2018, so only recent given the changes that have taken place in the country. The second is focus group discussions with subject matter experts. So these were 20 in total, one per state, and an additional 2 focus group discussions with the providers, the respondents to the GBV hotline, and also an additional one with experts on disability. And then the bulk really of the research was done by focus group discussions with communities. These were 211 in total. We selected the localities for rolling out this research based on the people in need numbers in the HNO. So we selected in total 50 localities. We rolled out focus group discussions with women, men, girls, and boys. And we also had focus group discussions with refugees and IDPs, again, based on the HNO numbers. Next slide. In terms of the implementation, and as was mentioned by Jennifer, this really follows the methodology of the Syria Area of Responsibility, which has been doing it for the past 5 years. And they have put together not only a how-to guide, but they were also very generous with their time, providing ongoing support via Skype about both the tools, the process, and everything. Of course, the process was adapted based on the context of Sudan. Implementation in terms of how the research was rolled out, practically speaking, we have a capillary network of youth in Sudan, so the Y-peer network. They were used really to both facilitate and take good notes of the focus of discussions. We had some training of the facilitators that was done virtually, also partly as a result of COVID. We developed the research tools and the methodology through a consultative process. So both the GBV subsector coordination groups, the protection clusters, ad hoc organizations were really involved in the design of the tools. We are doing the analysis through MaxQDA, which is a software for qualitative analysis, which is also allowing us to add a component to the analysis, which is a frequency analysis of how often certain issues come up. And in terms of a timeline, this is going to be most likely finalized in March, with the publication expected for April 2021 this year. The ambition is to do that every year and to make sure that this feeds into the HNO process. The next slide, very briefly. So this is the team that has worked on voices. So really made of, with me, the coordinator from the government side, a data analyst, Dimitri, a GBV specialist, Fatima, and also we had ad hoc support and input from people such as Yosto, who was in Sudan during his mission, was able to engage with voices. And next slide. In terms of the limitations and the lessons learned, well, one of the main lessons is that the capacity on the ground is very low, and we relied on the implementation through implementing partners that we didn't really have a working relationship with, which means that the data is not as high quality as I was hoping. It's also true that qualitative data is particularly difficult to get. So in the future, we are planning to do this through research institutes instead of maybe NGOs, although this is still to be defined. Also, one of the major limitations is that GBV is underreported, really. So the quality changes in the selection fully to the methodology due to conflict. We had conflict in West Darfur. Some areas were inaccessible. We had the worst flooding in 100 years in Sudan. We had dengue fever. We have COVID. So there was a little bit of adjustment needed. We have engaged with some partners, including UNHCR, CHR, in the GBV AoR, so to draw on the expertise of a larger pool of organizations. Also, in the next slide, to give a very quick snapshot of the emerging findings, only based on 4 states, so with all the limitations included. Domestic violence, we found domestic violence to be a key concern of respondents, both between husbands and wives, between brothers and sisters. And this also, includes the restriction of movement that most respondents reported, with not really being allowed to leave the house without prior, reporting to their spouse mostly. Women are excluded from decision making. Decisions are a prerogative of men. We also found a very high prevalence of child marriage and forced marriage. Also to the next slide. and particularly relevant to camp setting, IDPs and refugees, physical violence, particularly at distribution points, particularly at water points or during wood collection. We also asked some questions about the trends and the changes since last year. We found that COVID didn't really have a significant impact on GBV. People weren't really sticking to the stay-at-home rules or to the curfews. There was some change in the rates of FGM, where people reported an increase in the rates of FGM because with girls staying at home, that basically increased. Also the reporting, most people reported that there are informal mechanisms for resolving issues. And whilst men say that these are preferred because they take a shorter time and they are more effective, women mostly reported that they are unjust. I will close it here. I hope that I stick to my 10 minutes, but I would be really, really grateful if from anyone in this call that wants to address anything bilaterally. And of course, very happy to answer any question.
Thank you, Julia. That was super interesting. And I know some of you are familiar with the whole of Syria. I've asked people, because of time, to go ahead and put any questions that they have for both you, Julia, and for Josto in the chat, hoping that you can respond in the chats today. And then, you know, if I see that you put your email on the PowerPoint so people can contact you bilaterally. And also just to remind everyone that we do have a GBV AoR website that has a lot of information available if this is your first time knowing about the GBV AoR. And we can also get you in touch with Josto. So I'm going to suggest that we move on in light of time. They're super interesting presentations. So next time we will have less presentations with more time for discussion. Apologies. We're going to move on now for the 16 Days of Activism campaign. And this is moving back to the global level. So just to say that Philippe Carr is the GBV AoR communications specialist, and together with Shiva, who's, as you see, multitasking and helping us with this PowerPoint. They worked very hard to support the 16 Days of Activism, which we focused on highlighting the minimum standards, GBV minimum standards. And if you don't know them, definitely look at our website to become familiar. And there's a new facilitator's guide out that has like 600 activities that you can use to implement the standards or to share them with your partners and within your own agencies. But Philippe is going to focus on an analysis of how the 16 Days of Activism campaign went. I think many of you on this call were engaged in the campaign in your region or in your country or at the global level. It's from November 25th until the 10th of December. And so I'm going to turn it over to Philippe to explain how it went in the different regions and at the field and globe level. Thank you.
Thanks, Jennifer. So, first of all, apologies because my Wi-Fi is a little bit shaky at the moment, so we may, hopefully it'll hold up for now. I just wanted to introduce this by saying that the aim of this presentation really is not just to look at the achievements, but it's also to look at lessons that we learned from the campaign itself. It's the first time that we really did an online campaign using a lot of different assets to not only celebrate the 16 days of activism where there was a higher sensitivity around GBV issues, but it was also an opportunity to start to talk about, from the AoR's point of view, the minimum standards which had been released the year prior and was being or is being translated into a lot of different languages. And now currently it's the facilitator's guide is available as well. So as Jennifer said, there's a lot of resources that are out there. It's just a matter of letting people know that they exist and getting them into people's hands. So first and overall, you know, what did we want to achieve with this campaign? And first of all, it was to promote the interagency minimum standards. You know, you can see the cover there to the right. That was the prime issue that we wanted to do, and we wanted to use channels that were available to us, that we were been building up over the 3 months prior, and for the tradition of the GBV AoR. But we also wanted to build a closer cooperation between GBV AoR community on a communications level. So that means going to all our core members and our members and the community in general and saying, how can we produce something together and that's greater than all of us put together anyway. And by working on this campaign, we really did produce something like that anyway. So there's a lot of learning there, and it was a huge team building exercise on that level as well, which shows that we can provide large scale communications campaigns. Third of all, was to build up the communications capacity of the GBV AoR. So in the past, we were pretty much limited to the website, to our Twitter account, and also obviously to the community of practice and a few other places like that. But we wanted to try to build up a Facebook presence. We wanted to try to build up new channels like podcasts, using things like that as well, to reach different audiences that we traditionally didn't get to. And then it was a way to explore new forms of communication and evaluate where natural strengths lie as well. So we were able to kind of see, well, you know, how does the GBV AoR work together as a communicating entity? So those are the four aims. Prime aim, of course, being promoting the minimum standards themselves. The parameters, you know, they were, first of all, the primary audience we were trying to get to were local and national level audiences working in GBV programming in emergency contexts. That's really who we're trying to get through to. The timing is quite specific, 16 days, so we can start a little bit before, we can go on a little bit after, but that was really what we're trying to get through to. Online, unlike other years where offline activities are used to promote and celebrate 16 days, we were restricted to online because of COVID, obviously. We were lucky enough to have a budget as well that was provided to us that allowed us to create professional communications assets. So that was quite essential. And again, what we wanted to make sure was that all these assets were available in different languages. Some of them being non-traditional languages that we would have communicated in the past, such as Urdu, Kiswahili, or Somali. Working together, we also wanted a campaign that was uplifting and not depressing. You know, a lot of the visuals that you see online talking about GBV, especially when they're targeted towards people who work in the area, focus on the doom and gloom. And yes, it's a tough topic, but people working that area, you know, they're looking for solutions to that topic. So we wanted to strike a note of positivity with regards to it. And then we also wanted whatever creative we come up with to be relevant in as many regions as possible. So the final thing for me that was quite important, and that's the big thing, and I'll emphasize it a number of times, is running an online campaign is incredibly accountable. So there's an old adage in communications, you know, half your budget is used well and half your budget is wasted. With social media and with online media, you know exactly the profile of person who's following your campaign to the country level if you've got the right tools. So that's a really good accountable way of actually looking at things. Very quickly, the things that we produced. So we produced a 19-second kind of video which described what the minimum standards were, some of the scenarios that it takes on board. We also had some of our core members and some of the members of the wider community create endorsement videos. We've created a podcast series in French, and that's still running at the moment. We're still creating episodes, and hopefully within the next 2 to 3 months, we'll have 16 different episodes, one for each different minimum standard. We've been running webinars, both with the community of practice and with our regional groups as well. We produced a number of assets that could be used, small videos that could be used on areas of mental health and psychosocial support, which many of our colleagues helped us with. And then finally, we had a new dedicated web page, which was kind of an attempt to try and have something that's more accessible than the traditional GBV AoR web page, which it's a good information hosting tool, but sometimes it's not a visual enough, and sometimes it's not social media friendly enough. So I was going to show the video overall, but I would actually, I don't think I have enough time. And this was produced with a creative agency based in the UK. Again, it was translated into 6 different languages, and we've played it both over YouTube, Facebook, using Twitter as well, through a mix of organic, which is people coming across the video as it is, and paid for advertising as well when it's targeted at a specific audience. So the good thing with Facebook and Twitter is that you can actually go down to the country level, and you can go down to the actual demographic level of the person that you're wanting to go for, and even their professional level as well. So you can get down to a lot of different psychosocial kind of barriers with. You can't see, I don't know if you can see it here anyway, but it can be played from GBV AoR.net /GBViE. And you, when I'll send around the presentation, you can actually see that slide. So just moving on, what were some of the top line, statistics? Well, we looked at 2 different periods, the equal periods, the 9th to the 25th of November, which is the period preceding the minimum standards, sorry, the 16 days, and the 25th to the 10th, which was the 16 days itself. And what we saw overall is through the promotion that we did, through all the alliances that we created, through the social media campaign, we actually managed to boost overall users, so new users, by close to 100%. The number of sessions as well increased by well over 100% as well. So that's a good kind of indication of the traffic and how it increased. I'll show you the slide, and it shows the regionality of where people are coming to the web page. And because of this extra promotion, we were able to break away from just the traditional, Europe, of the Eurocentric kind of American kind of base that our website sometimes has. And we were able to increase representation and following and usage of the website from Africa and Asia especially. And that was through targeted social media activity. We were able to boost that. On social media, you can see the growth. So first of all, we started a Facebook page. It was particularly important that we do have this Facebook page because in regions like West and East Africa, it's the main social media channel. Previously, we didn't have that as an AoR, and you can see that there was a huge growth from practically 0 to Facebook to 3,000, 34,000%. That's basically just showing that actually the number of impressions was incredibly high. Twitter also saw a growth of 780%. And that was because of also the paid for advertising. We saw some LinkedIn activity as well, and YouTube as well. The smaller 2, LinkedIn and YouTube, are obviously all very small bases as well. Overall, on Facebook, we managed to reach 180,000 people. Our post engagements, we got 8,500 or so people. Number of likes, number of followers, for a first-time campaign on a relatively new channel. It really did show that we were able to boost activity in regions where traditionally we have a low following. On Twitter as well, we saw a huge growth in following, 528% growth in our following, with additional, impressions on the way. Our most successful tweet was the first one which launched the campaign, but we got a large number of mentions. And I suppose one of the by-effects as well of the campaign was we had a lot of new followers as well. We basically increased by a quarter overall new followers to Twitter. So that was successful in its own right in terms of building capacity. The community of practice events. I won't show all the events, the regional events, but these are the community of practice events, and there's an important learning here. We got a high number of registrations for the 4 different events, the highest obviously being for the introduction to the minimum standards event, which was put together by the community of practice and the task team, but also for themes like staff care, case management, and access to law. What I really want to show you, though, however, is not just the number of people who've attended, which were estimated at about 567 in total. It's the people in the first 3 weeks after who went on to view the videos online on our YouTube site. And that was an extra 301 people. And by now, probably 2 months later, we're looking at a situation that we're probably looking to equivalent the same amount of people who attended and the same amount of people who view the video after. So it really stresses the importance of post-promotion of your event, that it just doesn't end with the event itself. It ends, you know, it doesn't, it has life ongoing through YouTube and through spreading video through social media after. So build that into your strategy if you've got a social media strategy. We also had more signups on our podcast. We had newsletter, more signups. We had a growth of our YouTube platform, all very good. So what did we learn overall? You know, this is going back to the core of what the aim of this presentation was. And first of all, working together with the AoR as a mini communications task team works really, really well in creating effective content. It means we work together, we play on our strengths, we bring together ideas, and we can do that in a relatively quick way. So there are a number of people here on the call who contributed to that task team, and it was really quite effective. We managed to increase awareness overall of the minimum standards. You know, yes, it was in an accountable way to audiences that are traditionally underrepresented. So that was a really good finding that we discovered that we can do with a social media campaign. We've created a host of different assets that could be used and reused when explaining the minimum standards. That includes our videos and our podcasts. So that's those are things that can be used over 2021 and 2022 if we so choose. And then finally, you know, yeah, it's going back to social media is accountable. I put that down at the end, but it's something that we have. What we need to work on, and this is the goals of the communication teams are not always aligned with the GBV programming colleagues. So what we saw very often is we got great cooperation from GBV teams and from our core members. But when it got to using the communication channels in the different agencies that we work with, the communications teams didn't all see eye to eye with regards to spreading that. Very often they didn't see it had I suppose, a mass appeal, or sometimes they had a different focus because it was leading up to Christmas and it was perhaps more fundraising appeal that they wanted to do. So there's a mismatch there we have to look at. The second thing we wanted to look at is sometimes less is more. You know, too much content is not always a good thing. You spend more time creating copy that only gets a short usage. So we produced a lot of copy from a lot of different areas, but we didn't always get to use it in the most efficient way. And that's something to look at, to actually spend more time with more limited copy, but making it available in more languages. And that's the next point. So for instance, we were very successful for our community practice events that we had and our regional events, but there's an importance that we have a budget available for interpretation and translation. If we don't, we're losing out to some really important audiences. And then finally as well, you know, recordings of webinars are as essential as the events themselves. You know, if publicized through social media, we can double the audience of our in-person audiences. The other thing with regards to format, and this is something that the community of practice has learned for a long time, is that webinars that go over 60 minutes have a very, very quick depreciation rate. People start to lose attention spans at about 60 minutes, and you need to look at small, bite-sized chunks of content that people can easily absorb into their day as well. There's more competition for people's attention span, especially in the COVID world. Now, the final thing that I want to just bring to your, bring to mind as well is campaigns cost. You need to invest and have expertise from professionals like video producers, like web designers, things like that. When you do, and when you budget for that in your projects, you can gain that wider audience. If you don't do it from the start, you risk losing out. You produce an amazing piece of content perhaps, but there'll be very few people there to listen to it if there's not a communications aspect to the rollout plan. And that's it for me. So I've left my email there, and I'm free to take questions. Or if anyone needs advice on a campaign they're running, please feel free to reach out.
Yep. Please put any questions in the chat box if you want them answered now. And I encourage you, if you can stay on. I know the call has already been an hour and a half, but we still have Agnes, who's going to present on the course coming up in Nigeria in March. So if you can stay an extra 5 minutes, please, we'd appreciate if you can. So thank you, Philippe, and Agnes, we're turning over to you.
Thank you so much, Jennifer. Good afternoon, colleagues. I'm waiting for Shiva to put up the presentation, but just to mention that I'm here to present the GBViE course that will be running next month, but this is a follow-up to some of the courses that we've already done in Nigeria. Let's move next, Shiva. So basically, I want us to look at where we are currently in terms of current status, in terms of next steps. What is it that we see doing going forward? What are some of the challenges we face so far, and what would be the recommendations next? So currently, since I just want to give a bit of a background, since November 2019, we've been able to hold 2 courses on GBV in emergencies, which is mainly targeting local organizations and mainly women-led organizations. And so far, we've been able to have 24 participants graduate. And as it is right now, and why then we are in this meeting, is to be able to bring to the attention of the members that we have the 3rd course happening in March, and that is from the 8th to the 19th. And as a follow-up, we also had a coaching engagement that occurred after the course was undertaken, where we had 16 graduates supported by 16 coaches, and these included 2 reggers. So we had a 3 to 6 months coaching engagement, which then enabled the participants with the theory they had learned in class to practice. Just to mention again, the 2 courses comprised of one that was face-to-face and the other one that was a virtual course owing to the COVID-19 pandemic. So as it is right now, we are working on the revision and alignment of the curriculum and related materials, mainly aligning them to the global standards and guidelines, which includes the GBV minimum standards as well as the coordination handbook. This is in preparation of the 3rd cohort that will be happening soon. Next. So we also find that we continuously engage partners to be able then, once the situation improves, to offer the graduates of the course an opportunity to undertake a 3-month internship program, whereby then they'll be hosted and mentored by people or by organizations that are already in GBV practice. As it is, we also have had the university support through supervisors that have enabled participants to write short proposals as well as research papers on areas of interest, especially in GBViE. And we also had coaches that have also been supporting in terms of really sharing the experience as well as supporting the actors, especially the women-led organizations in their career in GBV. So we also find that one of the other key aspects that has improved the course is the enhanced linkage between the units within GBV, within the country office in Nigeria, that's a UNFPA country office, and also the enormous support we've received through the GBV AoR and especially the Western Central African Regional Office, the REGA teams. Then we've also been able to have subject matter experts who've been able to support in the development, in the review of the materials, and will also then be supporting in the delivery of the course going forward. Next. So we also find that as it is unique in Nigeria, we have the forensic lab that was established in one of the universities here. And what we're looking at is going forward to be able then to create a partnership whereby with the Spotlight Initiative, this university to be able then to enhance capacity building, especially on forensic evidence, which then will aid in legal response to GBV. Then again, to be able to identify how we can link the course graduates to GBV actors for their internship in order for them to be able to link the theory they have learned to the practice. And then as it is, as a partner, we continuously enhance or continue to enhance the capacity of the university to take up the GBViE course as a scheduled course, as well as integrate it to be offered either annually or biannually, and also be able to have it as part of their university calendar, and also then have some of the modules incorporated in their other offering, which would include the certificate, diploma, or master level courses that would be offered. This is mainly for sustainability in the long run, for the course to continue. Over. Please, let's move next. Then we also are looking in terms of partners coming on board to support future cohorts or courses. And I want to say that we've had very good feedback in terms of partners that are interested to support more courses to be offered, as well as scale up, especially in the region. And this also will be complemented by development of short tailor-made courses that will go to address the specific GBV actors' needs. And currently we are in the process of developing these courses that then will be offered again with the support of the American University of Nigeria. As it is, we also have developed an advocacy brochure that will be shared with all of us, that also sheds more light about the course itself. And we've also continuously engaged in the forum of the community of practice, whereby then we update our members on what is happening on the course and the upcoming courses, as well as any other areas that we can be able to partner in as far as capacity building is concerned. Next. So we find that as the course gains interest, especially in the region, we have more and more partners getting interested, especially to work on this particular course. However, we find that there is need for continuous engagement and understanding that the course itself, through the partnership and coordination of UNFPA, is what brings it all together in terms of providing the necessary linkages with the GBV AoR and other partners, especially when it comes to the development of the materials to be delivered, as well as the delivery itself, the technical teams that are involved, and all this then making sure that they are aligned to the GBV global standards and guidelines. We find that as much as we've made great strides in being able to reach out to many partners at local level, we find that due to the COVID-19 pandemic, at times it's taken longer in terms of implementing some of the key actions that we would have anticipated because of the very high demand for partners for these particular skills. And what we found is that it's taken a longer time to be able to reach our targets in as far as the numbers, but we continue, and we are glad to say that we are currently working on the finalization of the materials, which again will be pre-tested before the next course that will be coming up in 3 weeks. And just to mention again that we shall be sharing the call for application that has gone out, that gives more information about the course itself, as well as the advocacy brochure for those of us that would be looking in terms of areas of collaboration, as well as partnering in as far as GBV capacity building is concerned, especially for Nigeria and the region. Next. So what are some of the insights that we've come or we've got, especially as recommendations on how this course will be moved forward? Is mainly to continuously build the internal capacity of UNFPA as part of our transition plan to fully support the university to take up and incorporate the modules of this course as part of its offering. This would be very useful in that even post the funding of the program, then what will happen is that the course will still be offered in Nigeria and in the region. Then again, one of the key components is to be able to see how we can incorporate the new learning from the partnership to inform the revision of MOU with the university, as well as also inform future partnerships that we are going to have with other with other academic partners, especially outlining the very specific short, medium, and long-term strategies towards a sustainable course. Then also to say that, again, a key recommendation is whereby we are looking at continuously positioning both UNFPA and AON with the support of the GBV AoR to continuously deliver the course within Nigeria and the region, as well as aligning it to the GBV AoR commitment for increased university partnership in capacity building under the Global Call to Action Roadmap. Next. So again, to be able to, from the lessons we've learned and our engagement with the university, to be able then to continuously engage on institutionalization of the course by incorporating other departments within the university in order to tap into the technical expertise, to be able then to continuously have the materials developed as well as the delivery done of other thematic areas within the course. And then also, and finally, to have the AUN supported to integrate the course into their future, into their courses, their ongoing courses under the academic calendar, in order for this course to be offered as a scheduled course, as well as being able to be offered because of its target audience, who are mainly the local organizations, being able to be subsidized in the long run for sponsorship to happen, as well as for it to be affordable for those practitioners that would want to enhance their capacity in GBV. Next. Thank you, and I'm open for any comments.
Thank you, Agnes. I'm afraid we're already 10 minutes over time, so I think people will need to take their questions to you bilaterally. If you want to put your email in the chat, that would be great. Then people can contact you directly. I want to give a quick chance to Lee Ashley, who's our Riga in Bangkok, to announce this exciting webinar tomorrow. It is also in the chat. Oh, I do want to just say one more thing, following up with Agnes. And Agnes, thank you so much for that comprehensive presentation. We're very excited about this course, and the next one, as she said, is coming up in March. Just to give the background, this started off as a call to action commitment for the rolling out of call to action at the field level that happened with a lot of support from Christine Apio in both Nigeria and DRC. And that was how this course really started off, was as a commitment to the call to action with the GBV AoR. And this is something that we would like to see starting in Francophone as well. And really have been appreciating the interagency support as well as the support from the university and UNFPA. So we think that it's great that it's been able to go online, and even during COVID, we've been able to see this course move forward and support, as Agnes mentioned, mostly local organizations in Nigeria. So thank you so much, Agnes. And Lee Ashley, if you can quickly announce this very exciting webinar that's happening tomorrow morning, or I guess it depends what part of the globe you're in. Morning for Europe and in the afternoon for Asia.
Thank you so much, Jennifer, and thanks for having us on the call. I really enjoyed it. Yes, tomorrow, please join us for a very exciting webinar. We're going to be exploring the topic of COVID-19 vaccinations and what are really the implications for GBV prevention and response in humanitarian settings. Our very own Pamela Marie Godoy will also be sharing guidance from the GBV AoR for GBV coordinators to really help us think about how we can make sure that in the planning and the rollout of the vaccination campaign, protection and GBV considerations are at the center. So I've put the link at the box. Just go to the GBV AoR website and register, and we look forward to seeing you tomorrow. Over.
Thank you. It's very exciting. I know, like, and just to say, there's going to be also closed captions, I believe. Is that true?
Yes, we will have American Sign Language and closed captioning available.
Great. So please share that with others if you have constituents who would be interested in knowing that we have really tried to make this as accessible as possible. And it's a very interesting panelist and great group of speakers. So as we mentioned, we're looking forward to this tomorrow. It's now 4:15. I just want to thank everyone. For those of you who stayed on, we're at 46 participants still. We were up to 82 at the beginning of the call. And like I said, we're very open to feedback, our topics that you'd like to see covered in future calls. Please do have a look at our website. If you do not currently receive the GBV AoR monthly update, do please sign up for it. You can do that on our website. You can also, if you're a GBV specialist, sign up for the community of practice on the website and learn about the help desk. So there's a lot of resources available, and please do feel free to take advantage of those resources. If you have more specific questions, I think most speakers did share their emails on the chat. If you don't have access to the chat, we will be sending out the PowerPoints that were presented by each of the speakers today, and we will have a recording available on our website, since I know that there were some people in your organizations who were not able to attend due to conflicting priorities, and so we will make this available to them as well. So thank you all, and thank you for putting your introductions in the chat. It was nice to see a good mix of field people and also global and regional level. So thank you very much, and we look forward to your feedback. Bye, everyone.